Good afternoon. My name is Annette Warner, and I'm the Director of Education for Comfort Keepers, which is a home care company. So, today we're going to talk a little bit about how home care can help some families with the stress that they're experiencing during this pandemic. But first, I want to talk about a little bit about Navigate Home. Navigate Home is a group of professionals who get together and hopefully will be a resource to you for questions that you might have about aging in place. Um, it could be questions on elder law. It could be questions on placement, selling your home. It could be questions about moving. It could be questions about Medicare. These are some of the resources at Navigate Home we'd like to have and share with our community. So, Navigate Home is a large community of resources that you can use. So, with the pandemic, there's so much uncertainty about the future of coronavirus. We don't know what's going to happen next, so it leaves us at the edge of our seats. We've already been experiencing over 6 months of agitation, not being able to go to places we normally went to. We possibly have a parent that is living on their own. Now, all of a sudden, where they could take care of themselves, they became the most vulnerable. So, as a result, we find ourselves being caregivers. And now we're a caregiver not only for our parents, we're trying to work from home, we're trying to educate our children at home. And it's like, how many more things am I going to be responsible for? Excuse me. So, family caregivers have been experiencing a lot of stress during these past few months. If you have a family member that you could share some of these experiences with, that's fantastic. But if you're a primary caregiver with no support, no help from someone else, what can you do? What can you do to alleviate some of the stress in your life? So it's important at this time for families really to come together. And if you haven't made a plan yet, it's time for you to make some type of a plan. How are we going to approach these next few months where maybe going outside is not going to be as easy as going outside in nice weather? Maybe it's going to be a terrible snowstorm. How do you get to your parents' house? How do you prepare a meal for them? How do you get them their medication? So, right now, senior centers are closed. Hopefully, they're going to come back, but not at 100%. Adult daycare centers, a lot of them are closed. Some are open, but the majority still are not taking patients. And maybe you're one of those people who are not tech savvy and you don't know how to maneuver on your computer and to find out what resources are available in the community. So the first thing I want to talk about is, what is the difference between home care and home health care? Well, the first thing is, home health care is covered by insurance, but it's covered by insurance after you have a hospitalization. So if you're in the hospital for 3 days and possibly you don't go to a rehab facility and you come home, you have the option of having skilled nursing. You would have the option of having occupational therapy, physical therapy in your home. And at that point, Medicare and your supplemental insurance will pay for that. They pay for that for a short term, and then you no longer have that. So, what are your options? Well, your options, either a family member steps in and handles the things that they do. And usually, if it's a nurse or physical therapy or occupational therapy, They come into your home maybe 2 times a week, three if you're lucky. They only come in to do what they were called there to do. So a nurse may come in, she may take your blood pressure, she may check your heart, she will make sure if you're congestive heart failure that you haven't gained any weight since the last time she was there. And physical therapy will come in and do exercises, occupational therapy, the same. Well, okay, there's maybe 3 hours in the week. What do you do with the other 165 hours that are left in the week? Can you maneuver in your house by yourself? Is it safe? So your son or your daughter is not able to assist, isn't able to help you. And that's where home care can come in. Home care is private pay. Unfortunately, Medicare or any insurance other than long-term care will cover the benefits of home care. Home care comes into a home, but before they come into the home, usually a client care manager will make an appointment to speak with the family and the individual who may need the assistance that the family feels they need. We will do an assessment. The assessment will ask about medications, lifestyle, hobbies. You know, you're a person. What do you like? What do you enjoy? Um, what are your needs? What are your expectations? What's the hardest thing, especially as a caregiver, that you're finding you can't get done? So home care not only can do personal care, which is activities of daily living, grooming, dressing, toileting, possibly transferring from a wheelchair to a chair or a bed. They also will do incidental or instrumental activities of daily living, which is your laundry, cooking, errands, doing medication reminders because all of a sudden you're forgetting what time you need to take your medicine. They will actually, the client care manager will come in and do an assessment of your home. Are there any fall risks around the house? Do you need grab bars in the bathroom? Do you need grab bars in your shower? Are there too many small rugs around your house where now the ability for you to fall because maybe you haven't been out of your house that much is even higher and you're at risk? So home care comes in and does the assessment. We don't tell you what you need. You tell us what you need. Home care companies make sure that they're bonded, insured, make sure that their staff is covered by workers' compensation, make sure that they run background checks on individuals that they hire, and make sure that it is you clearly make them understand what are your needs. Why are you there? Do you notice that your parent is becoming more forgetful because of the lack of socialization that they have in their life? Have they had any recent falls? How's their hearing or vision? And so many of us forget to think about that. As we get older, our hearing decreases and our vision that was once 20/20, now we may not be able to see 5 feet away from us. So we can't see that those counters are dirty. We forget that we have dishes in the sink. We are not able to bend down and put the dishes in a dishwasher or clean the dishes. We're incapable of cleaning our home. So if that helps us to stay in our home for a longer period and a family member can't do it, home care can step in and do activities such as the ones I've discussed. Um, is the person whose home it is a smoker? Have you noticed that they're being very careless with their smoking? Are there burn marks anywhere? Are there scorch marks on pot holders or dish towels that you never saw before? Is the routine house cleaning just left and now it's disgustingly filthy? Are there expired foods in the refrigerator? Do they get Meals on Wheels to help you prepare a meal for them, but they're not eating the whole thing? No dates are on the boxes in the refrigerator, so how do you know if they're eating something that's bad for them? Are there expired cans in their cupboard? Is Someone can go through expired cans. What kinds of social activities are your parents involved in? If they're not able to go to church and that was their primary socialization, how are they entertaining themselves? Who are they talking with? Are they just looking at television all day? Home care, having a caregiver in the home, can provide that mind stimulation that all of us need. It's not just about good nutrition, it's not only about good health, but it's also about stimulating our minds, having fun, and doing some projects. What do they enjoy doing? Have they Do they have a normal routine for bathing? Is it difficult for them to bathe? Are they afraid to bathe by themselves? Home care can do anything from a standby assist, where an individual might be afraid to be in a shower by themselves and they just want someone outside the door or in the bathroom just to be there in case they have difficulty. Then we have the individual who may need someone to help them undress. They may need a helping hand into the shower. They may need someone to help dry them off or wash their hair because they don't have the ability to reach up and wash their hair, nor can they reach their back. They may be able to still clean the private parts of their body, and a caregiver can easily soap up a washcloth and they can clean themselves. So, what can happen is that if if a family feels they can't do some of these things, instead of getting in arguments or feeling resentment for your family member, it's really important to take a few hours a week, even if it's 1 or 2 days. And I realize when it's private pay for some families, it becomes a little difficult. So maybe you only need someone once a week. Usually there are minimums. Our minimum is 4 hours, a 4 hour block of time. It can't be 2 hours and 2 hours. A lot of times families forget to realize that caregivers, this is their job. So to drive a distance and only work for 2 hours, it's not worth their time nor money. Um, are they insecure in their home? Are there things that they would like to do to get out of the house, even if it's not going to a restaurant? Maybe they'd like to go on a drive. Maybe they would like to just walk around a park. What are some of the outdoor activities as long as it's safe? Can they just walk in the neighborhood? Is it nice to get someone out on their porch and just sit with them and chat and look at what nature has outside? The leaves are changing. You see different types of birds as in the fall as you do in the summertime. So these are all different types of things that can be done with a caregiver. Our caregivers, and I'm sure most caregivers and home care companies, you families will say, well, what are you doing to protect yourself? Our caregivers have been working all during COVID. We make sure that our caregivers have masks, our caregivers have gloves, because we don't want them sick, nor do we want your family members to be sick. We want them to be safe. Every day they have to take their temperature. They have to report and answer questions before they even go on a shift to make sure that they are healthy. If by any chance they would not be able to come, a family member would be notified, and we definitely would take every precaution to let you know if it had to do with COVID. The nice thing about using a home care company is that if someone can't be there for any reason on a day that they're scheduled, there usually are backup caregivers that can come and take their place. It's up to a family member to decide whether this is something that they know their parent would accept or not, or whether the family would accept or not. So many times that caregiver and client or patient creates such a wonderful bond, they don't want anyone else. And if the family feels, or if the patient feels that they would prefer not to have a substitute caregiver, that's totally up to the family, and we would respect that. If it's us calling, we will call you as soon as we know if there's any issues. If, for example, your mother's not feeling well and all of a sudden you have to take your mom to a doctor's appointment and you can't make it, we can take your parent to that doctor's appointment. If you want to take them to a doctor's appointment, just make sure you call the office with enough advance notice. Of course, if it's an emergency, that's one thing. We respect that and we will make sure our caregivers are notified. Making sure that there is communication between the home care office and the family and the patient is critical. Even though the caregivers are working that shift, the caregivers work for the home care company. So they cannot make any decisions. Everything goes through their client care manager. Every caregiver is assigned a client care manager. What if, for example, they are on shift and your mom or dad falls and you think, oh my gosh, what are they going to do? If your parent can't get up without direction, then we will call 911. We will make sure that your parent is safe. We will keep them calm until 911 gets there. We also will alert our client care manager, and that client care manager will alert the family and let you know what occurred. Reports have to be completed by the caregiver and the client care manager to let you know, did your parent have to be moved to an emergency room, or did they just need a helping hand? Was it just difficult for them to get up? We don't want our caregivers to be injured, nor do we want our patients to be injured. So we are really very, very cautious about the care that we put into the home. We're on call 24/7. Many times people will use home care. Say, for example, you want to go up north, but you know that that would be really difficult for your mom or dad to go up north with you. But you don't feel comfortable leaving them at home by themselves that entire weekend because you're not sure how they're going to get their meals. Are they okay? You can't see them. Many times we'll be called in on short notice jobs. We plan on going 2 weeks from now up north, and we know it would be difficult for my mom or my dad to go. Is it possible for you to have a caregiver work 4 or 5 hours a day, Friday, Saturday, Sunday? And we would schedule that. So home care can be used on an interim basis. It could be used long term. The other way home care is used many times, if someone has a hospitalization and they don't go to rehab, but yet they come in home and that first week or two, they're just not themselves and they need a little bit more assistance. Well, if you're working and your family is working and there's no one to help mom or dad other than moving them into your home, and many times that's very difficult, then home care could come in and possibly work extended hours. Many times we will work 24/7s for a week, sometimes 3 or 4 days, just until that person is able to function themselves. So I hope that this gives you the information you need on how home care can alleviate some stress during COVID times and others. One of the other things that home care offers is emergency monitoring systems. They also have safety technology. So make sure you do your homework, read on a home care's website. What do they actually give, or what are some of the services they provide? How can you utilize them? And have your questions ready. When you're ready to talk to a home care representative or a client care manager, what are your expectations? What are the things that you're looking for that can help that individual who is living by themselves? Sometimes it's a couple. Can maybe it's two people and they can't prepare their food, and maybe you're hired only to prepare meals for them. So we're not there, like I said, we call it interactive caregiving. They tell us what they want us to do. So in a combination, even though your parents older, if they're living independently, they have the ability to have a conversation with you as a parent and a sibling and as their children, to give you an idea of what they want. So making sure you plan, know what your needs are and what you want. I will put, I think I can do this. I will put my information down. And if you would like to contact me, please feel free to email me or check out our Comfort Keeper website. And hopefully it answers questions that you have. I'm writing all of this down and hopefully you can see it. I want to thank you for joining us on Navigate Home today. And I hope if you have any questions, you will come to this Navigate Home page and look at pre-recorded services that we have performed in the past and listen to items that we've discussed from, like I said, elder law, home care, PACE programs, all different aspects of resources that a community needs. Thank you for joining me and good afternoon.